The highly transmissible Delta variant is putting more groups at risk.
Pregnancy is now considered an independent risk factor for severe COVID 19 infection.
Regardless of how healthy the woman is.
So you're more likely to have severe symptoms, you're more likely to end up in the ICU. And what's even more concerning is that there are some published studies now that are suggesting that pregnant patients who are unvaccinated and who get COVID 19 infection are also more likely to deliver premature babies.
Dr. Jose Prieto is the medical director of the Division of Internal Fetal Medicine for Johns Hopkins All Children's Hospital. He says there is a surge of pregnant women who need to be hospitalized because of a severe COVID-19 infection, and a majority of those patients are unvaccinated. Unfortunately, a similar situation at Sarasota Memorial Hospital.
The volume of sick pregnant patients has absolutely skyrocketed the past several weeks.
Dr. Felice Barron is the director of maternal fetal medicine at SMH. She explains how COVID-19 impacts a developing fetus.
The baby doesn't get COVID from mom. It's not as if mom has COVID and the baby's going to get COVID in utero. That doesn't happen. But it's something about the COVID infection and all the other things that COVID sets off, what you hear about with the inflammation and the other chemicals that are set off due to the COVID infection. Something about that is the placentas are taking a hit and the babies are getting stressed and sometimes going into distress.
To protect the mother and her baby, Dr. Barron and Dr. Prieto highly recommend the COVID-19 vaccine for expectant mothers. They say the shot is safe to get at any point during pregnancy. They also recommend the vaccine for women who want to get pregnant.